my God, Carolina, is that how much you love me?
Yeah.
What do you like?
Good. I'm hanging in
Good
there.
afternoon, residents.
It's probably like.
I know some of you are still grabbing your food and thank you for being here today for our Creighton Alliance MedEd Grand
Hawaii
Rounds.
is definitely.
I'm Dr. Jessica Seaman, Academic Success Consultant for residents and faculty. We have a very timely session today, Burnout and Resiliency, by two very knowledgeable presenters, Dr. Katy Coan and Stephani Wolfe. Before I introduce them, please know that we are recording this session for your future reference, and we will share the slides and the recording through multiple platforms by late next week. Dr. Coan is an endocrine and general surgeon here at St. Joe's. She is actively involved in research and medical student and resident education. She is currently the division chief of St. Joe's General Surgery and active in improving patient quality and experience. We're glad that she's here with us today. Stephani Wolfe is a licensed clinical social worker that has held a variety of positions dedicated to mental health, advocacy, and educational pursuits. She is currently supporting medical learners as the Creighton Alliance Wellness Director. We appreciate both of them for sharing their time and wisdom with us today. So I believe Dr. Coan, you are starting, so I will turn the time over to you.
Thank you. All right, thank you very much. Hi, guys. I know everyone is like, what better than a burnout lecture in PowerPoint? Fantastic. We'll try to make it a little entertaining, at least. We've all been here, I understand. Over here. All right, so every talk needs objectives, right? So what is the history of burnout? Because I actually didn't know, which is kind of interesting. What is burnout actually? Because it's everywhere. In fact, there's burnout for Animal Crossing. There's a 5-minute YouTube video if you're so inclined to check it out. What can we do about it? Burnout is everywhere, right? You just Google burnout and here you are. Burnout, 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 burnout. I mean, we're burnt out on burnout, right? I mean, it's kind of ridiculous. So where did burnout actually come from? Is it like 2020 COVID burnout became a thing? No. Actually, it was described in the 1970s by Herbert Freudenberger and Christina Maslach. We decided to pronounce that. So anyway, Herbert Freudenberger. Freudenberger was actually a psychoanalyst over in New York, and he volunteered at a free clinic. He was a volunteer, but the free clinic actually didn't refer to it being free. It referred to like a free way of life. So they treated people with drug addictions, alternative lifestyles, that kind of thing. So he's working his, psychoanalyst job 12 hours a day and then going here till midnight. And so he misses a flight to go on vacation with his family. He's absolutely livid. And he reflects on this. And at that time, everyone tape recorded themselves and psychoanalyzed themselves afterwards. Makes sense. And he noticed that he was really upset. And then he looked at his staff who were also pulling these ridiculous hours, working with this very challenging patient population, and noted that they had symptoms that were similar to the drug addicts they were treating. And when a drug addict kind of gets to that end, right, they're on heroin so long, they describe them as being burnt out. And he said, we're all kind of like that. Oh, and then here's a QR code. If anyone has not scanned the QR code, please do so now. Get credit for being here. So I really like this quote from Freudenberger, is how he describes it. As a practicing psychoanalyst, I have come to realize that people as well as buildings sometimes burn out. Under the strain of living in our complex world, their inner resources are consumed as if by fire, leaving a great emptiness inside. Although their outer shell may be more or less unchanged, only if you venture inside, you will be struck by the full force of desolation. That was a pretty descriptive view of burnout and actually pretty bleak. And this other, Pascal Chabat, who's the author of Global Burnout, describes burnout as, like substance abuse, burnout is an illness of immoderation. I thought that was also very telling. And that sometimes when we're describing burnout, maybe burnout isn't burnout. So really describing it accurately, I don't think, I think sometimes we downplay it by not using the correct terminology. So Christina Maslach at the same time was actually on the West Coast getting her PhD, and she was studying how people respond to crises. And she's interviewing people in the service sector, healthcare providers, police officers, and ministry, et cetera. And she started to notice these common themes, also, again, consistent with burnout. And so initially, she thinks this is kind of interesting. no academic journal would publish her because they didn't really think it was that interesting. So she ended up getting published in something called Human Behavior, which is maybe more well-read than the academic journal, which is probably for the best. And all these people started coming up to her and saying, wow, I also really feel like that. So she ended up creating with Susan Jackson, a PhD at Rutgers, the Maslow Burnout Inventory, which is like $50 if you're so inclined to take it yourself in multiple questions. But it's a widely used framework for identifying and measuring burnout and actually contributes to the new ICD-11 code for burnout. So burnout breaks down into these 3 dimensions. So exhaustion, cynicism, and negative self-worth. And then 6 workplace risk categories: workload, sense of control, reward, workplace relationships, fairness, and values alignment. So now that we have kind of that fascinating history that it didn't show up in just 2020, it was actually really big in the 80s. I'm older than all of y'all, but I did check with my parents. This is true, apparently. Like the 80s was like, you can go into, there wasn't the internet. So it was like magazine quizzes that you could take whether you were burnt out, so you know. So per the ICD-10, it's an occupational phenomenon, but not classified as a medical condition. Burnout is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed, and is characterized by 3 dimensions: exhaustion, detachment, and ineffectiveness. Sounds pretty similar to what we just heard. So exhaustion, the depletion of internal resources you need to respond to the physical, cognitive, or emotional demands of the job. Exhaustion is not what you feel after a long or difficult day, but the feeling that most days are long and difficult. So this is tired, not exhaustion. So things that contribute to exhaustion: putting in long hours. This may start to sound familiar, guys. Just overwhelming amount of work. Being given big problems to solve with few resources to solve them. Feeling overwhelmed with all these demands. If you can't relate, I want to join your residency program. Let me know. The concern is that there's more than just exhaustion, right? There's detachment. So a sense of disconnection from your work, from the value that you bring to your work, less emotional connection, leads to cynicism and doubts about whether what you really do matters or if you're making a difference. So people who experience burnout may actually feel emotional distance, resulting in a loss of empathy. Obviously, this is very important in our line of work. Once you lose empathy, it's kind of a challenge anyway. And then ineffectiveness, a sense of incomplete and lack of accomplishment, but it's less to do with how much work gets done, but more about how energized and rewarded you feel by it. I do like this picture. I feel like this person was not actually being ineffective because this is quite a high quality human hamster model. There was a lot of effort put into this. I just want to acknowledge that. I also want to know what that person does and how do I join that special. And how confident you feel in dealing with problems and how big a contribution you actually make. So the workplace risk categories, again, workload. According to my colleague, Dr. Jordan Weinberg, the chair of surgery in the General Surgery News as of that came out yesterday, the biggest workload factor for burnout for surgeons is hours, probably for most of medicine, it's just hours in the hospital. So disproportionately large number of workloads, tasks that exceed your skills or training. I think this can be a challenge, obviously, and work that doesn't capitalize on your strengths. Control, as a former resident, medical student, et cetera, and even sometimes as a staff, you have a high responsibility, but low decision-making authority. You must deliver, but you can't choose the best way to do it and are forced to do it in a way you don't necessarily agree with. It can be super frustrating. Reward or lack thereof may be tangible or intangible. It could be monetary, it could be vacation. It could be you wanted the pat on the back and you got this situation instead. This is a t-shirt if anyone curious who buys that. But the other thing is community, working with people who do not share the same values as you, people you can't rely on, or people that you have conflict with can obviously result in a negative workplace. Lack of equity, when one person gets the vacation days and the other person doesn't, is that fair? And then values, obviously if your values are inconsistent with your organizational values, that's a big issue. I think the organizational values are inconsistent is actually to some degree a bigger issue, but it's actually more hidden. This is kind of like when they talk about the hidden curriculum. It's what we tell people we do, but how we do it are not aligned, which I think always results in some internal strife. And you may feel pressure to engage in actions that seem unethical or contrary to your values, which is not going to make you feel awesome. about going to work every day. So signs of burnout: lack of interest or enthusiasm, apathetic or negative attitude, poor work performance, exhaustion, and physical symptoms: insomnia, chest pain, headaches, increased illness, heart palpitations, shortness of breath. That's okay. GI distress, and mental health issues: anxiety, depression, substance abuse, ultimately suicidal ideation and self-harm. So burnout is different from fatigue, and I think this is a challenge. Over here, see, I'm living in my corner. Fatigue, dementor, burnout, okay? Empty room. So they can occur together, not surprisingly enough. Burnout's not binary. It's not like you're burnt out or you're not, in my mind. There's kind of a spectrum to burnout. Fatigue is commonly a precursor to burnout. Fatigue is more physical, burnout's more psychological. Fatigue, you're kind of tired at the end of the day, kind of like that kiddo. Burnout, you're exhausted before the day even begins. Fatigue can have the absence of positive emotions or a little bit of bleak thinking, like maybe this isn't gonna be the best day, but burnout crowds out all positive emotions, the negative ones. It's just that empty black hole of despair. So what can we do about it? Everyone, little yoga time. Little yoga time. So, resiliency. So like, oh God. So I don't know if you guys know this doctor. He is on TikTok, but I also on Twitter. If you're not into the TikTok, here we go. Hopefully this plays over yonder.
Sir, you wanted to see me? Yes, Bill, please, come in. Okay. Bill, it's been brought to my attention that you haven't done any of your resiliency modules. Oh yeah. You do know that physician burnout is a huge problem right now. Yeah, I know. So what do you think we should do about physician burnout? More days off? No, a mandatory 8-part online curriculum designed by people who have never taken care of patients. Really? That's the best way? Of course it is, but how can we measure your gains in resiliency and ultimately publish it in the New England Journal if you don't finish the modules? I mean, I could just tell you right now it's not going to make me feel better. Whoa, we'll let the 4-page self-assessment questionnaire answer that. Oh God. What if I don't do it? Well, then you'll have to complete a 3-hour course on the importance of professionalism. Fine, but can I at least have the afternoon off to finish the modules? No, you can become resilient on your own time.
Oh, I know. And yet we're here. It's not an 8-part resiliency module. The quiz is, the survey is only 5 questions. I would ask for your feedback on this because we do want to improve these lectures for you guys in the future. But it's not 4 pages, just so you know. Let me go here. But of course, there is, I know, surprise, surprise, a journal article. There are many on resiliency, but this is a JAMA article from 2020 on resiliency and burnout among physicians in the general US working population. And so they studied over 5,000 physicians. It sounds kind of impressive, but they actually tried to survey 30,000. So there's that response rate. And they looked at resiliency scores versus burnout. Overall, physicians were more resilient than the general population, which is honestly no surprise when we talk about what contributes to resiliency, to be honest with you guys. Resiliency does appear to be protective against burnout, and even resilient physicians are burnt out, okay? So what is resiliency? Again, with definitions, I think it's important for burnout. It's also important for resiliency. Resiliency isn't just sitting around doing some yoga. So the ability to adapt well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. As much as resilience involves bouncing back, it is also an opportunity for growth. So this is life, right? Life is not always smooth sailing. Sometimes it's kind of like the rapids. Sometimes it's more like this situation, you know? But resiliency empowers you to grow and even improve your life, especially in tough circumstances. So you kind of end up here, ultimately. So what resiliency isn't? It's not this. It's not some magical potion or unicorn. I just love this picture because it's just so like fabulous. But being resilient doesn't mean that a person won't experience difficulties or distress. That's not it. Life isn't that. The road to resiliency is likely to involve considerable emotional distress. Some individuals are more resilient than others, but resiliency isn't like a personality trait. There's no gene for resilience. You don't have it or you don't. It involves behaviors, thoughts, and actions that everyone can learn and develop. And it's like a muscle. Increasing your resilience takes time and intentionality. If you go to the gym and you lift 3-pound weights every day for a year, you're not really going to get too far. except for my husband who said, well, what if I started out with 1 pound weights? And I said, well, thank you, honey. So it's very helpful. Resiliency in my mind is more like a rhinoceros. It's real, it exists, it's kind of fluffy. They're pretty cool. There are rumors that rhinoceroses and myths run towards fire, which I thought was pretty telling for resiliency. Maybe those myths aren't actually true if you actually look at the literature, but just so you know. We'll have more rhinoceros facts coming up, so pay attention. But really, there's lots of articles again about how to become resilient. And looking at this, I think there's 4 core components, and I agree with these: connection, wellness, healthy thinking, and meaning. So build your connections, prioritize your relationships. Pain can lead to isolation. It's very easy to go into a dark place. Reach out. Residency is amazing. You do not appreciate until you get out how much you loved your colleagues and being able to just commiserate about the same situation. When you go into practice, find a group where you have people that you can relate to. It is so valuable. If I have a surgery case and I want someone to come in, they will absolutely drop everything they're doing and show up. And that's who you want in your lives in the future. Foster wellness. Take care of your body. Nutrition, exercise, and sleep. Practice mindfulness, mindful journaling, yoga, a spiritual practice. Gratitude goes a long way. Even though it seems kind of, oh, just gratitude. It actually helps. And then avoid negative outlets. Drugs and alcohol, not the answer. Will get you in trouble. Being on the credentialing committee for the hospital, it's a thing amongst physicians. Be aware. So I think sleep is super important. I was one of those people who was convinced that I was like the abnormal. I needed 5 hours of sleep. That's not true, guys. Most adults need 6 to 10 hours of sleep in a 24-hour period, with most people requiring 8. After one night of missed sleep, I know it's shocking, cognitive performance can decrease by as much as 25%. After a second night, it can fall nearly 40% of baseline. In experimental studies, adults who get 4 hours of sleep can function reasonably well for short periods of time, what we do on call, 2 to 3 days, but performance is clearly suboptimal, even in the short run. And sleep debt continues to build over time until adequate sleep recovery is obtained. It leads to slower response times, altered mood, motivation, reduced morale and initiative. And rhinoceroses also need 8 hours of sleep. So find purpose. I don't think this is necessarily in many of our jobs that hard. I think this is part of the reason physicians tend to be more resilient, right? Most people find meaning in their jobs. But there is this interesting study about money. I don't know if anyone's heard this before, but they gave folks between $5 and $20 to 2 different groups of people. They tested their happiness before they gave them the money, and then they said you can either spend it on yourself, group A, or you can spend it on someone else, group B. And at the end of the day, the people who spent it, group B, actually were happier when they spent it on someone else, regardless of the amount of money. So if you just want to give me $5 to feel better, that'd be just fine. Give your friends, buy Starbucks for someone, and maybe yourself too. Be proactive. I think sometimes problems become so large that they almost appear insurmountable. I notice this more in my current job, that it just seems so big that how could I possibly tackle changing this, that, or the other in the department? So it's kind of like, how do you eat an elephant? 1, you don't, that's disgusting. But 2, if you're going to do it 1 bite at a time, maybe start with part 26. So move towards your goals, develop realistic goals to get you ultimately where you want to go. Having some type of lifelong plan, as opposed to floating in the breeze, goes a long way. I am not the best planner, so I think I take this one to heart. And then look for opportunities for self-discovery. Be curious. Growth does come from discomfort. No one gets better at anything by feeling comfortable doing it. No one wakes up knowing how to do a thyroidectomy. I don't think. I haven't met them yet. So life is outside of your comfort zone. Stress is important. I think stress gets a bad name. Stress gets a bad name in my profession, in that cortisol is related to stress, and stress must be bad. If you have no stress, you're not getting out of bed in the morning at all. You're just laying there. Now, stress can get to a point of being unhealthy, kind of like substance abuse. In moderation leads to burnout. So embracing healthy thoughts, keeping things in perspective. Thoughts are just thoughts. In the surgery realm, it's if you don't have complications, you don't operate enough. I'm sure it's the same across all of your fields, that if you don't see enough patients, you're not going to have complications. But thinking about those complications and ruminating on them does not make them go away. Thinking about the ostomy that looks purple and not pink does not make it pink, I promise. I've tried it. It's a study of 1, but it doesn't work. It still stays purple. Accept change. Change is a part of life, which can be good, right? When things are kind of crummy, change is good. When things are good, ultimately, they're probably not going to stay amazing. So it is inevitable. Maintain a hopeful outlook. There are always a blue sky above the clouds. Always important to remember that. And then learn from your past. Take time to reflect. So you can't ruminate on the osprey going from purple to pink, but you can ruminate on why it happened and change it the next time so you don't have 3 purple ostomies or EKG misses or bad burrs. Lots of things happen that I'm glad that you all deal with, not me. And however, the past is doomed to repeat itself if you don't reflect on it. Kind of like this situation. This is not optimal. You can, if anyone owns this concoction, there's some talking to do. So now that said, the straw that broke the camel's back. I like this woman. She was talking at a CME event. And to some degree, we put our focus on trying to make the camel stronger. Tell the camel to meditate. Tell the camel to be more mindful. Tell that camel, you better sleep more, eat better. Encourage that camel to exercise and coach that camel to be more resilient. Right? Camels can only be so strong. We can only be so resilient. Sometimes we need to make environmental changes. So addressing the EMR, workload, or clerical burden can help. Also, seeking help can be hard, but professional help can be extremely valuable. I don't know how that went there. Anyway, but it's important to remember that you're not alone on this journey. And so with that, I'd like to endure it. Welcome, Stephani. Yeah, endorse her.
She's coming back. Thank you, Dr. Coan. Okay. Lovely. So thank you, Dr. Coan, for sort of setting up all of those great definitions and explanations. One of the things that we got partnered on was me being able to step in and sort of talk generally about what the individual resources are that are available through your programs and through Creighton, and then also sort of what the institutional resources are that are available to you. So listed on this page are sort of some initial places to start. If you or someone you know is in immediate need, what the crisis lines are either by phone or by text. The counseling resources available to you under Creighton Employment are through our Creighton EAP, which is that 1-800 number. That line is staffed 24/7 by a therapist. So they will help triage the call and help get you connected to the services, whether that be counseling services or other financial resources, legal resources, any of those things that are baked into your benefits. One of the things that I found particularly helpful, sort of buried in the Creighton benefits that I've connected a couple of different residents with, is the fact that we have an institutional membership to BetterHelp, which is a telemental health app. And so if you call the 1-800 number, you're able to go and ask them for access to the BetterHelp. They send you an activation email, and then you would have 8 sessions through the BetterHelp app, just like any other paying customer, which is actually a wonderful sort of first point of contact. They guarantee contact with a counselor within 72 hours. And you have access to that provider through text or call through the app itself. And if that counselor that you initially get matched with isn't a good fit, you just hit a button and say, I'd like a new counselor, and they help behind the scenes pair you with a new person. So those are some really excellent resources available through your benefits and that one singular 1-800 number. I'm also available for individual consults. So if any of these pathways don't sort of get you where you need to go, I'm really here to talk about all the different dimensions of wellness for all of you, either individually or within the program. I've done different programs within specialties, obviously coached residents individually, and I'm here to sort of capture where those themes and trends are across the institution, again, so that we aren't just trying to make you all stronger, but we're really responding at an institutional level. A couple of the ways that we do that is through our Safe Ride Home program. And so if you are post-call or fatigued or nervous about driving, you always are welcome to get a ride from Uber, and then just bring the receipt from your ride to your program coordinator within 7 days, not business days. That doesn't apply to all of you. And we will refund that through GME funding. Another institutional way that we are here to listen and again, not just expect you to resolve any circumstance, is through the Help Someone form. So that QR code, which is also linked from the wellness webpage, will get you to a form where you can identify either for yourself or someone else, a person who might need some additional care, whether that's follow-up resources, or just because you're noticing something in a person that you see, whether that's students, residents, faculty, or staff, that then the institution can be responsive to those things. Your program directors and chiefs are always resources for you. Each of the hospitals has a confidential reporting line if you have concerns about compliance, quality, or safety. And then GME itself has a Google form that you can fill out through that QR code on the second column, where you can report mistreatment, unethical, or unprofessional behavior. All of these feel particularly important because we know that feelings of helplessness or feeling stuck can really contribute to burnout and detract from resiliency. And so knowing what your sort of immediate pathways are at the institutional level and at the individual level are really important for you to just have eyes on. Again, these slides will get distributed for all attendees, so you'll be able to get back to that as needed. I have done my part. So I'm gonna let Dr. Coan wrap up for the take-home messages with all of your menagerie.
I don't know how to do that.
I don't know, I'm
Is that okay?
Take-home messages, bring them home.
Take home messages. So the rhinoceros, also where parathyroids were discovered, just so you all know. But burnout is real. Not everything is burnout. Stress is in fact part of life. Growth comes from discomfort. You can try personal mitigation strategies, physical, mental, and emotional, and then system mitigation strategies, system changes, clear expectations and resources. Please talk to your programs. Please reach out. Please reach out to Stephani to get help. Ultimately, burnout needs to be multifaceted. I really like this quote to end with, is that we're all stronger than we know. Simultaneously, we're all more vulnerable than we'd like to acknowledge. And with that, you have some remaining time that is protected. Do something good for yourself. Buy your friend a coffee, some stretching. Do your survey. Do your survey. It's five questions. We try to make it as painless as possible. Please give us feedback so we can improve this. Thank you guys so much for your attention. Have a good day. If you have any questions, you can always find me.